Counseling for Tobacco Cessation, Part 2, Content. The first part covered an overview and an approach to counseling. This part covers content of the counseling session. Our objectives are that you'll be able to describe how to set a quit date. You'll explain the symptoms of nicotine withdrawal and dependence. You'll be able to explain cognitive-based therapy approaches, and you'll list stress management and relaxation techniques for help in the quit attempt. Setting a quit date. Effective counseling programs generally involve setting a quit date, and quit rates are higher for patients who stop smoking abruptly. A trial of smokers found that gradual smoking cessation was associated with decreased abstinence at 4 weeks when compared with abrupt smoking cessation, 39 versus 49%, with a relative risk of 0.8, and it was significant. So people were 20% less likely to be successful quitting if they looked at 4 weeks when they gradually reduced compared to setting a quit date and stopping completely. One suggestion is to have the quit date within the next 2 or 4 weeks, making it something that someone would start planning for in the near future, but not so soon that they wouldn't have time to prepare. One of the recommendations is to tell family, friends, and coworkers about that you're going to quit and request understanding and support. And another is to remove tobacco products from your environment prior to the quit date. If you know that you smoke in your house, clearing your house out, getting rid of all the tobacco. If you know that you're smoking the car, clearing all of the tobacco out of your car. And again, so the language here is not always from motivational interviewing, but you can provide evidence that it's more helpful to quit completely rather than stop gradually. I don't think people have to be directed to stop, but offered evidence that it improves their chance to quit successfully. You can give them information about handling nicotine withdrawal symptoms and other barriers, and you can have them bring up other barriers to quitting. And then depending on the medication dose, you can discuss pharmacotherapy, which would be started on the quit date for all but bupropion and varenicline, which are started a week before the quit date to give time for a maintenance level to reach, to give time for the blood to reach a maintenance level. All right, so you're talking to someone about quitting smoking. You're using the motivational interviewing approach, which infuses your entire dialogue. And you begin with suggestions about the helpfulness of setting a quit date. And the next thing you could do is discuss what happens after your quit date. What are the symptoms that you can expect to experience so that you can be better prepared? And the addictiveness of nicotine is the primary barrier for smokers when they try to quit. Nicotine is a potent psychoactive drug. It causes physical dependence and tolerance. And in the absence of nicotine, a smoker will develop cravings for cigarettes and the symptoms of nicotine withdrawal. The symptoms do peak in the first 3 days of smoking and subside over the next 3 to 4 weeks, but can last for several months. Symptoms typically include increased appetite and weight gain, changes in mood, dysphoria, which is just a general malaise and not feeling interest in doing things, depression, insomnia, irritability, anxiety, difficulty concentrating, and restlessness. And again, if you discuss what happens when people quit, people will be more ready to respond. We've described the idea of setting a quit date. We've described the idea of discussing nicotine dependence and nicotine withdrawal symptoms, and now we're coming to strategies for dealing with nicotine withdrawal symptoms. There are cognitive-based approaches basically address two areas, identifying triggers, as well as problem solving and skills training. The first one we'll talk about is identifying triggers. The smoker who anticipates quitting could be encouraged to identify situations or internal states or activities that may increase their risk of smoking a relapse. Well, I always smoke on my smoke breaks. I smoke in my house when I'm bored. I smoke when I'm under stress from the kids. Knowing what situations cause the person to smoke is the first step. And common triggers include stressful situations, being around other smokers, drinking alcohol, and smoking cues. For example, drinking coffee. One idea for aiding smokers to quit is decreasing time with other smokers, and in particular, creating smoke-free homes. And once these dangerous situations have been identified, there are several strategies involved with problem solving and skills training, which are based on the identified triggers. Beginning an exercise routine probably has the most evidence for efficacy in helping to deal with triggers for smoking. It reduces stress and improves quality of life. And it also addresses a common concern that people have about gaining weight after they quit. If the person finds someone else to go for a walk with every day, it can increase their sense of support as well as getting their physical activity. And some studies actually do suggest that when smoking cessation and exercise programs are combined, smoking cessation rates improve. We described this concept of creating a smoke-free home as a way of dealing with triggers, and we described starting an exercise program. Other ideas for coping strategies using cognitive-based therapy are improving your sleep, just getting a regular night's sleep, which can help reduce overall stress and improve quality of life, similar to exercise. Minimizing the time spent in the company of smokers, and if there's a smoker in the house who isn't quitting, the recent ex-smoker could develop with them a no smoking policy in the home or the car. Behavioral distraction. So a lot of people will need something to do with their hands, and choosing a repetitive or simple activity to engage in, like doodle or knitting, can be helpful. Other coping strategies include cognitive distraction, so creating to-do lists, thinking about what work needs to be done. For people who have an oral component to their smoking, drinking a glass of water, or having a small healthy snack, chewing gum. Positive self-talk and visualization. Thinking this will get easier, or visualizing yourself not smoking. And then understanding the benefits of quitting, remembering the health benefits of quitting smoking. And I think that this laundry list is overwhelming for anyone hearing this talk, and it would be overwhelming for a person to be given them in a list. So perhaps just put these away in your back pocket and think, it's going to be my job to figure out what the person identifies as their triggers and what they think they would do to address that trigger. And then if they have my idea, if they have the idea on the list, you could say, wow, that's exactly what I read about. Or if they don't have the idea, you could offer it as a suggestion. And lastly, besides cognitive behavioral approaches, we have stress management and relaxation strategies. Stress is a commonly reported barrier to quitting smoking and maintaining abstinence. And if a patient identifies stress as a trigger, stress management strategies, for example, deep breathing, guided imagery, progressive muscle relaxation, brief meditation, or stretching may be helpful. And it's not up to you to figure out to learn all of these techniques to teach the person necessarily. But if the person says stress is a big deal and a big cause of their smoking, and you ask them what has worked for them for reducing stress, and they might know exactly where to go for the kind of thing they think would work. And if they don't have the idea, you could suggest deep breathing, and then you could ask them who might they ask to help them with that if you don't have the information yourself. And then clinicians can encourage patients to be aware of their stress symptoms. Maybe it's muscle tension, maybe they become irritable, maybe they have difficulty concentrating, maybe they start drinking alcohol, and then they can practice these techniques to counter the stress and avoid smoking.